House Select Subcommittee on the Coronavirus Pandemic is opening an investigation into the Biden administration's COVID-19 vaccine mandate. Congressman Brad Winstrup, who chairs the committee, said in a statement that the committee will be looking for data on former employees who were fired because of the federal government's vaccine policies.
Winstrup also said, quote, although all federal mandates have since been rescinded, overturned, or otherwise ended, the detrimental consequences of these policy decisions continue to affect thousands of Americans, and the federal government's egregious interference in the sacred doctor-patient relationship will undoubtedly have long-lasting ramifications. Now, President Biden implemented the mandate for federal workers and international travelers in September and October of 2021, but ended it in May 2023 when the public health emergency was lifted. So, there's broad agreement between not everyone that the mandates were unwise, that a lot of the mandates were unwise policy. Obviously, the Supreme Court struck down President Biden's mandate for employees of many private and public companies. There have been court decisions to reverse firings or get back pay from officials who lost their jobs because of mandates. I don't know maybe there's something to investigate here. It's, how Republicans are in a let's investigate everything we're mad about mood. Some of those I think are really legitimate investigations. Maybe this is too, but it's more, I think we all understand how this came about, right? It was a policy that we're against. I don't know what to investigate about it, but.
Yeah, I don't know that there is going to be much in the way of finding wrongdoing. If the goal is to make people whole who were harmed by the policy, I certainly support that and agree with that. I think that, when the government acts in a way that causes real professional financial harms to groups of people because of laws that it puts in place, that, of course, as when anyone else harms you in any other kind of tort scenario, you should be able to be made whole. It's the foundation of my belief that reparations are not only morally necessary, but legally necessary for people who lived under an apartheid system in the United States of America until the mid-60s. And I certainly support the case out of New York, where I believe it was firefighters that were made whole after being let go because of this COVID mandate policy. So that, I think, would be a good use of time. Any time that people are trying to put money that was taken back in the hands of working people, that is a great exercise of the congressional time.
Yeah, I agree with that. So maybe they have a task force to identify people who lost jobs or opportunities because of these mandates. Would be a good thing. There's still, again, I say this all the time, the only places I can really tell that there are still some vaccine mandates in place are colleges and universities, which still are requiring, I believe the University of Michigan, where I attended college many years ago, they're going to require the bivalent booster for people coming back in the fall. Even as
is there
most
much pushback on campus at all about that?
I don't know. I think there's some, but not very much.
And how are they going to enforce compliance even?
I think you get like a vaccine card, right?
Even the vaccine cards were, very easily forged.
Right now. I
had a picture of mine on my phone that I was showing at restaurants when that was required in D.C.
Do you remember that?
And, I remember thinking at the time, and at one point I had two, because when I got my booster, I didn't have my original card with me, and they gave me a second one. And, at a certain point, it felt very performative. If anybody wanted to avoid getting a vaccine and still get into restaurants, it seemed very easy to do.
Maybe you have to have the doctor or the CVS send over a official letter or something to your, you're trying to get your dogs into daycare. You need the vet to send a letter saying they've been vaccinated for all these things.
Yeah.
Now we're doing that for people.
Apparently, yeah. I'm not sure about the merits of that. What do you make about the language that's been used here about protecting the private decision-making between a doctor and a patient? It obviously is evocative of the language, pro-choice advocates have been using.
Yeah, I think that's deliberate. Of course, virtually all elected Republican officials are are not on board with that in that case.
Like,
but,
I get that it's maybe an attempt at a dig at the left, but I feel like it's just opening oneself up to the reality that, yes, consistently, like someone like myself, I'm happy to say that the mandates were an unwise infringement, given that they didn't have the public health effects that were promised, and also women should have a right to choose.
Yeah, there's a lot of medical related hypocrisy for both political parties.
Yeah.
I think that's basically undeniable.
Well, last week, the White House launched a new Office of Pandemic Preparedness and Response Policy, writing in a statement that it will be, quote, charged with leading, coordinating, and implementing actions related to preparedness for and response to known and unknown biological threats or pathogens that could lead to a pandemic or to significant public health-related disruptions in the United States. White House Press Secretary Karine Jean-Pierre revealed last week that the White House still adheres to strict COVID protocols, especially for those who come in contact with the president. This is interesting. I've seen a number of articles recently that point out the way that we discussed a little bit post Davos, that rich people of means, are still protecting themselves, are using UV lights, are using high quality ventilation systems, are requiring the people around them to be masked. And there is, I think, an interesting question as to whether in our, I think, legitimate interest in having our civil liberties protected and opposing certain kinds of mandates and the like, we are also making ourselves vulnerable like sheeps to slaughter, while the wealthier people understand that there's real risks presented by, say, long COVID and the like. And that isn't there a middle ground where we expect some support from the government to help us avoid contracting a virus at the same time that we don't want to be mandated to do things that aren't well tailored to protecting us from the effects of the virus?
I mean, I don't know. Everyone, if you want that additional protection for yourself, you can wear a mask. I find it pretty doubtful that there's a lot. You think rich people, maybe, I guess, rich liberals or something. I don't know that rich conservatives are being hypocritical and wearing masks in secret. I think it's over.
I think when you get to a certain point of affluence, it's not red or blue, it's green. And, there's a bipartisan mix at the top whose interests are shared against the broader 99%, as we discuss ad nauseum on this podcast. And I do think, I've always really emphasized the air purification systems. There was some money allotted to that, but we don't have the quality of air ventilation in your average school in the United States that these affluent people, these wealthy people, are availing themselves of in their own private spaces and homes. In fact, I think Marianne Williamson just tweeted about this last night and got a little bit of pushback from people who I think perceived her as being pro-mandate or something like that, but was basically tweeting that we need to have more I'm trying to see if I can find it real quick. We need to have more investment in ventilation systems and distributed masking and things like that so that people can choose, like they actually have the support to protect themselves, even if it's not mandated.
I mean, the federal government gave the schools $189 billion to do whatever they wanted with it, and spending that on better ventilation would have been a great use of that money. So I hope that schools take advantages of the resources we gave them to do just that.
I found it. She said, COVID is still a threat, and there are many long COVID sufferers. We should reinstate mask mandates in healthcare settings, ensure free high-quality masks and PCR tests, and mandate effective air filtration for all public transportation, buildings, and businesses. What do you make about that? Is that a mid-range position?
No more mandates.
The health settings is an interesting one, because I have seen people say, well, I'm literally vulnerable from a physical perspective. That's why I'm going to the hospital. There's going to be people, obviously, who are immunocompromised. That's why they're going to a hospital. People who have all kinds of infectious diseases. That's why they're in a hospital. And who have to be there because they're sick. They're not choosing to be there. This isn't a restaurant. And for healthcare officials to be able to basically expose themselves to you in a place that you would rather not be but have to because you're sick and therefore vulnerable. Do you think there's more of an argument, whether or not it's a mandate, for there to be continued masking in these healthcare scenarios?
If the healthcare, I would leave it up to them. If the healthcare facility or doctor's office wants to have that policy, and fine, and if you don't like it, you can go somewhere else. I think I even know some older people who need to make regular visits to the doctor or the hospital or something who would not go if they were required to wear masks.
No, not the patients. I think the issue is like the providers. I mean, maybe the patients as well, but especially since for some kinds of tests and things, you have to take your mask off.
Yeah.
Like you have to. If I'm going to do a lung test, I did a stress test at some point earlier in the pandemic, and I started in a mask, but it was hot. I'm running on an incline. That's the whole point of a stress test. Are you going to be,
I would just leave it to the discretion of the doctor, the administrator of the medical facility to make that determination.
Yeah. Well, interesting stuff. We'll have more Rising for you right after this.